So this is a case where I'll be showing you the ExoCAD designing video where we have designed on Neodent GM helix implants at implant level. The intraoral scan was done using the VirtuoVivo intraoral scanner using scan bodies number 7 intraoral scan body from Neodent GM line. And now, as a verification, before we proceed with the milling of the final superstructure, we have a 3D printed model. The 3D printed model is pretty accurate, and you can see here the tissue has been printed separately as a detachable component. And now we have to just make sure that there is a good fit of the printed resin prosthesis, which is basically a 3-unit bridge from 4, 5, 6, and we have to just make sure that it fits nicely without the tissue mask which is printed. And we have to try and engage the screws. So we'll try and check the fit now. I'll show you some interesting part about this is that the prosthesis will not fit with the tissue mask which is printed in places, because when we used to have analog models, this tissue mask used to be in an elastic resin, which used to be basically vinyl polysiloxane, like a addition silicone. So now, since this is printed in a hard material like a resin, this will cause interference with the fit. And we have to just make sure that we check the fit of the final prosthesis without the tissue mask in place. Make sure that the screws engage onto the model, like you can see here, onto the analogs, the digital analogs which are incorporated in the printed model. Now I'll just remove this. Basically, before we do that, I'll show you the occluding model, which has also been printed in 3D resin with a nice articulation for the vertical stop. You can see, you can verify the occlusion as well. This has been printed at Precision Dental Studio, which is in Thane. They are my lab partners for this case, and as always, I've always been working with them for a very long time. So now we'll detach this, and I'll remove the printed bridge, which is going to be verified in the patient's mouth today. And you will see a corresponding video which will also show you the ExoCAD designing for this case. The software used for the designing is ExoCAD. The intraoral scanner which is used is VirtuoVivo from Straumann, and it comes with an inbuilt software. The tissue, like you can see, it fits beautifully onto the model. This is printed separately as a detachable component, and in this case, since the emergence profile is deeper, the tissue mask will cause interference while seating the printed bridge, because it's going to seat much deeper inside in the patient's mouth. It's going to emerge out from the submergence area of the mucosa. So the detachable component always has to be excluded whenever you take a trial fit on a 3D printed model. This was the expert advice for today. See you soon for many more updates based on digital dentistry. Bye-bye.